Global. Joining me now from Leamington Spa Live is the Lloyds Pharmacy Chief Executive, Toby Anderson. Toby, welcome to you. Are you seeing shortages of any medicines right now?
No, we're not seeing any shortages. We are extremely busy, though, and it's a very stressful situation for our wonderful teams. And I'd like to thank those amazing teams. I mean, last week alone, we served safely more than 2 million people across all of our Lloyds pharmacies, which is pretty incredible because we managed to open every pharmacy this week, despite having sickness in our own workforce and across the communities. So a big thanks to both Lloyds Pharmacy, but all community pharmacies out there that are really on the front line of helping the government to fight this terrible virus. And I wanted to thank some of our customers too. I mean, we've had to make some operational changes, and I really appreciate their patience, particularly those customers who have given our team some appreciation. There's a mum in the West Midlands near here that her son just came out of a liver transplant 20 days ago and desperately needed medication. We were able to help her. But I have to also say, unfortunately, some of our frontline workers have experienced some abuse, unacceptable abuse as well. And just yesterday, I had to temporarily close 6 pharmacies because of violent and abusive behaviour. And I want to appeal to everybody. We're all in this fight for COVID together. And I really would like to appeal, please show the respect that the pharmacy teams need so that they can safely dispense medication for you and for your loved ones. And every day, they're putting themselves at risk, day after day, helping people in the community, particularly where GP surgeries are closed and self-isolation is very high. They are facing significant pressures, and we are having record volumes of prescriptions. We are coping and we are serving you, but our teams are pretty exhausted.
I'm very sorry to hear that, Toby. I mean, have you had to put security guards in place at some pharmacies?
We haven't. Our teams are doing that. We are diverting all of our resources, everything we've got, at keeping our pharmacies up and running. All of our clinical staff are in the field. We've redeployed over 300 people from support centres. We've had an amazing response from our friends and family. 250 people have gone into warehouses to ensure the flow of medicine to hospitals and pharmacies. And as you mentioned, we've got an appeal out there for another 1,500 people to come and help us. The challenge, though, is there's only a certain amount of clinical people out there with the skills that are required. And so we've got to put in place these protective measures to look after our frontline healthcare workers. And that has unfortunately led us to put in place the queuing system, social distancing. We're putting up screens on the cashiers and providing our employees with protective equipment and masks.
All right. Toby Anderson, got to leave it there, I'm afraid. Thanks very much for joining me. Good to see you.